to take stock of our efforts thus far to identify our gaps and determine the way forward. I'd like to virtually call on Dr. Richard Monang for his brief opening remarks. Let's please put our hands together in person and virtually for Dr. Monang.
Thank you very much, Mr. MC, the Honorable Minister of Environment of Senegal, the Director of Veterinary Services and the Director of Lab Services, Ministry of Health, African Union representatives, sister UN agencies, FAO, WHO, the World Organization for Animal Health, organizers of this timely event, representatives from government, non-state actors, all protocols observed. Bonjour tout le monde. I take this earliest opportunity to express on behalf of the United Nations Environment Programme our great appreciation for the privilege of being the rotational chair of the quadripartite, taking over from our colleagues. We will not lower the bar from the very high leadership standard that has been set. Colleagues, distinguished ladies and gentlemen, we gather here today at a very important time. And this could be summed up in an African proverb that where there are experts, there will be no lack of learners. This African proverb analogizes this workshop. It is a gathering of experts who want to learn from each other to strengthen solutions to a critical health risk of our time. I'm talking about the antimicrobial resistance. Just take a minute and imagine this. Annual antimicrobial resistant deaths have surpassed those by deadly HIV and malaria globally by 147% and 198% respectively. The majority of these deaths are in sub-Saharan Africa, with 24 deaths per 100,000 compared to high-income countries, which record about 13 deaths per 100,000. Even more alarming are projections that up to 4.1 million Africans will die yearly from the scourge by 2050. Decision makers across the African continent have taken commendable remedial steps, and key among them being the establishment of the national action plans for antimicrobial resistance. To date, up to 39 countries have a NAP in place, while another 5 are awaiting government approval. As we gather here today to share lessons, to strengthen implementation, the environmental dimension is a key area that needs strengthening. Distinguished colleagues, ladies and gentlemen, the science is unequivocally clear that environment is both a risk multiplier and a source of solutions to the antimicrobial resistance. Just this year, the United Nations Environment Programme released a flagship report titled Bracing for Superbugs, Strengthening Environmental Action in the One Health Response to Antimicrobial Resistance. This report contextualized environmental action to combating antimicrobial resistance. According to this study, curtailing pollution created by pharmaceuticals, agricultural, and healthcare sectors is critical to reducing the emergence, transmission, and spread of superbugs, which are strains of bacteria that have become resistant to every known antibiotic which underpins AMR. The report called for a multi-sectorial One Health response, which is the underlying principle to the work of the quadripartite. Specifically, as a risk, environmental drivers of biodiversity loss, climate change, pollution, and waste are turning our environment into an accelerator and reservoir for antimicrobial resistance. When it comes to climate change, the 2022 UNEP emissions gap report noted that global temperatures are headed towards unsafe warming levels of up to 2.8 degrees. This is alarming because studies have shown that antimicrobial resistance is accelerated at higher temperatures. Africa is warming twice as fast as the rest of the world, implying that continued escalation of antimicrobial risk will only be compounded. When it comes to biodiversity loss, Excellency, distinguished colleagues and gentlemen, the continent has lost up to 39% of its vertebrate population alone, and is estimated to lose up to 20% to about 50% of various species as we speak today. These losses reduce the buffer between human and animal pathogen habitats, thereby increasing risk of cross-infection. For instance, Africa recorded a 63% increase in diseases spread from animals to humans between 2012 and 2022, the highest that have ever been recorded globally. When it comes to pollution, up to 90% of Africa's waste is disposed of in uncontrolled dump sites and landfills. An estimated 60% of healthcare facilities in the least developed countries, most in Africa, are not equipped to handle hazardous medical waste, which leaks into the open environment. Runoff from plants and livestock production, including agrochemicals and other pathogen-laden waste from industrial refuse and untreated sewage, also end up in the open environment. These pathogens are then recycled back to humans through various forms, including contaminated food, including water and air, to cause diverse infections. For example, up to 115 people die every hour in Africa from inadequate sanitation. Africa has the world's highest per capita incidence of foodborne illnesses, with up to 137,000 lives yearly. There is also indoor pollution, where smoke from biomass-based cooking energy causes respiratory infection, with up to 700,000 deaths, the highest globally. These infections relatively contribute to the continent holding the unenviable position of having the largest burden of infectious diseases in the entire world, accounting for over 227 million years of lost health life and over 800 billion lost in economic productivity. The inviolable consequences, Excellency, distinguished colleagues, ladies and gentlemen, only show a highly infectious disease load that is only increasing the risk of antibiotic overuse and misuse. For example, as we're speaking today, a study records that up to 90% of households in one of Africa's largest slums had used antibiotics in a year, compared to just 17% of the typical American family. In some countries, up to 71% of 5-year-olds are given antibiotics without a prescription. This overuse then gives rise to drug-resistant pathogens that are also shedding into the open environment and recycling back to humans. A vicious cycle of disease, a vicious cycle of reinfection, and a vicious cycle of treatment resistance and death. On the flip side, the environment is also a source of solutions. The United Nations Environment Program is at the forefront of propagating them through creative thought leadership in increasing environmental action ambition. For example, the United Nations Environment Program is working with state and non-state actors across the entire globe to limit global temperature rise to 1.5 degrees, a safety limit needed to prevent further unraveling of weather patterns and multiplication of which is the least emitter. We are also guiding countries to invest in simple, affordable, clean energy solutions, like simple solar dryers that are critical to the realization of food safety standards that lower the risk of foodborne illnesses. We are also guiding the uptake of waste recovery to clean cooking solutions that lower the risk of indoor pollution, while at the same time protecting our forests to maintain our biodiversity and ecological buffer that lowers cross-infections from animals to humans. We are supporting member states to invest in nature-based solutions that reduce the impact of agricultural sector on our environment by substituting chemicalized fertilizers with nature-based solutions like biofertilizers. We are driving investment in waste recovery to value, including waste to electricity that incinerates up to 90% of municipal and medical waste for dual benefits, preventing the release of such waste into the environment, while at the same time generating clean electricity to power socio-economic development in countries. The UNEP is supporting the uptake of these environmental actions through an enterprise lens. Because let's face it, Africa is an informal continent, yet at the same time, having over 60% of the population being youthful, and any action taken to put antimicrobial resistance at bay must be able to generate enterprise opportunity to create jobs for this youth. Africa can be able to generate up to 320 billion annually and create up to 3.8 million jobs if actions are taken to drive low carbon manufacturing opportunities. These incomes will be critical to enable communities to afford better sanitation, to afford quality treatment, to lower misuse of antibiotics, and over-the-counter medicine. All these interventions lowers the risk of antimicrobial resistance. As you learn from each other today, distinguished colleagues, ladies and gentlemen, enhance your national action plans. The environmental dimension that I've discussed needs to become a critical pillar of the DEDNAP. This will be critical to address the implementation bottlenecks that you are facing, and some environmental dimensions that should enrich the next NAPs are as follows. And the first point is data. There is a need to enrich the health surveillance data systems with environmental dimension, the state of the environment in terms of mapping out environmental risk drivers, their temporal and spatial distribution, as well as the needed solutions shared earlier towards lowering the antimicrobial risk is very, very critical. The second aspect is investment drivers. AMR NAPs needs to be accompanied by investment plans that elucidate environmental solutions that can unlock income and enterprise opportunities at the macro and at the micro scale to adequately finance AMR solutions at the household and economic-wide level. The third, there must be incentives for solutions. There is a need for incentives to catalyze enterprise environmental solutions that address AMR. As earlier shared, specifically, when we look at incentives, skills retooling for our young people and financial, physical incentives to lower the cost of credit will be very, very critical to tap the youth and informal sector as developers and propagators of such solutions in community. Therefore, capacity enhancement is important. Training institutions and curriculums at diverse levels need to be strengthened with an environmental dimension to ensure health professionals are well equipped to address environmental risk and tap the environment as part of the menu of effective solutions. The fifth, policy coherence. Policy is the biggest driver of change. Yes, we know. Environmental solutions such as waste recovery, to clean cooking, to clean energy for food systems, to pollution reduction are direct contributors, lowering the risk of infections arising from unclean cooking and foodborne illnesses and pollution, among others. Health policies therefore need to adopt such actions as part of solutions to lower the risk of infection, be it respiratory, be it foodborne or sanitation related, which will have the knock-on effect of reducing antimicrobial use, which lowers AMR. Distinguished colleagues, ladies and gentlemen, as we get to work today, I take this opportunity to thank our quadripartite partners for the progress so far, and to count on your continuous support towards strengthening the environmental dimension in the national action plans for the benefit of the continent, knowing fully well that when spiders unite, they can tie down a lion. Our collective endeavor can make the continent not only safe from antimicrobial resistance, but will pave a journey that will make Africa a prosperous continent. Thank you very much.
And let me add, in the unlikely event that there was any amount of uncertainty about the scope, the gravity, the magnitude of antimicrobial resistance, Dr. Munang certainly helped us understand how serious, how dire the situation is. We now know that many, many lives are on the line. I love how Dr. Munang reminded us about the providence that lies within the environment. The solutions can certainly be driven by the environment. We need to look at our energy sources. We need to look at our energy resources. And we do know that the focus is towards more renewable energy resources. I also love the fact that Dr. Munang reminded us about a large constituency of the African continent being young people, and how important young people are to help brainstorm, find, and implement solutions. He also reminded us very seriously and very importantly that policy is the biggest driver of change. So we need what we need to do within one-on-one spaces, within large spaces, to advocate for policy change, to make sure that we sensitize the policymakers and that they are aware about how serious, how real this problem is. Ladies and gentlemen, I would imagine that already you might feel a little overwhelmed. already within the confines of a few hours, you've had to ingest, you've had to assimilate a wealth of information. I would understand, given the beautiful warmth of Dakar and the amount of information that we've had to take in thus far, that it may be a lot right now, that there may be a small need for a brief health break. By a show of hands, who would support a motion for a brief health break roundabout now? Are so few in support of a health break right now